There's a type of cancer that can quietly grow in your neck for years. No pain, no fever, no obvious symptoms until it's too late to treat. Welcome to Golden 60, a place where we share practical, trusted health insights to help you live stronger, longer, and more fully every single day. If you're over 50, or you have loved ones in that age group, this might be one of the most important videos you'll watch this year. Because the condition we're talking about today, thyroid cancer, isn't dramatic. It doesn't scream for your attention. And that's exactly why it often slips by unnoticed. A little hoarseness in your voice, a slight lump in your throat, a kind of tiredness that just doesn't go away. We've all felt things like that, haven't we? But here's the part most people miss. Those subtle changes. They could be early warnings. Soft signals from something serious, already taking shape inside your body. Stay with us through the end of this video, because what you learn today might help you catch it early, protect yourself, and even save someone you love from a disease that may seem harmless, but can change everything. Right at the front of your neck, there's a small gland that many people never notice. It's called the thyroid. And even though it's small, it plays a huge role in how your body functions every day. Think of the thyroid as the control center for your metabolism. It affects your heart rate, your body temperature, your daily energy levels, your weight, your mood, and even how well you sleep. When your thyroid is working well, your body runs smoothly, like a well-conducted symphony. But when something goes wrong, even something very small, you might start to feel it. Tired for no clear reason, low energy or low mood, trouble sleeping, anxious for no obvious cause. Or you may gain or lose weight, even though your eating habits haven't changed. The problem is, these symptoms are often vague and easy to blame on normal things, like aging, stress, or poor sleep. And that's why so many people miss the window to detect thyroid issues early, including thyroid cancer. So why does thyroid cancer often show up in adults? According to studies, most thyroid cancer cases are diagnosed in people over 50, especially in women. Age is an important factor. As we get older, cells are more likely to grow abnormally. If you've ever had a thyroid infection, long-term iodine deficiency, or a benign lump that wasn't monitored, those can all raise your risk. Some people were exposed to radiation, from dental treatments, head and neck scans, or even their environment, but never knew. Others have a family history of thyroid problems, but assume they're fine. Still others notice hoarseness or swelling in the neck, but because it's not painful, they don't get it checked. And by the time a visible lump shows up under the skin, the cancer may have been growing silently for years. Women are especially at risk, 3 to 4 times more than men. Not because they're weaker, but because the thyroid is highly sensitive to female hormones. Hormonal changes, especially around menopause, can alter how the thyroid works and how its cells behave. So what's the first thing you can do to protect yourself? Not panic, but understand your body better. Know how your thyroid is functioning, and be ready to listen when it starts to speak. Thyroid cancer, in most cases, doesn't cause pain. It doesn't make you cough up blood, or spike a fever, or leave you completely drained like other serious illnesses. But it has its own way of letting you know it's there, quietly, gently, like a whisper from inside your body. Take a moment to ask yourself, have you noticed slight swelling in your neck? Ever felt a small lump or a little tightness when swallowing, even just once? Has your voice been hoarse for a few weeks and it just won't go away? Do you sometimes feel like something's stuck in your throat, even though nothing's really there? Or maybe you just feel more tired than usual, even after a full night's rest. If you found yourself nodding, or even just pausing to think, don't ignore it. These might be the earliest signs that something is changing inside your thyroid. 6 common warning signs people often miss. 1. A small lump or mild swelling in the neck. 2. Hoarseness that doesn't go away. 3. Difficulty swallowing or a feeling of tightness. 4. Pressure in the neck when lying down. 5. Ongoing fatigue despite rest. 6. Unexplained weight changes. If these symptoms last longer than 2 weeks, treat them seriously. Thyroid tumours often grow slowly, but once they spread or turn aggressive, treatment becomes far more complex. You can catch it early and treat it effectively if you don't wait. The opportunity is there. Sometimes it's just one simple checkup away. Early detection steps. 1. Thyroid ultrasound. 2. Blood tests, TSH, T3, T4. 3. Fine needle aspiration. 4. CT or MRI. 5. Genetic testing for medullary cases. A small tumour caught early. Often a simple surgery. Wait too long. It may spread or press on vital areas. Treatment options. Thyroid surgery. Radioactive iodine therapy. Hormone replacement. Radiation or chemotherapy in rare cases. The good news: with early treatment, the 5-year survival rate for most thyroid cancers is over 98%. This isn't the end. It's a quiet reminder to care. Now, not later. Treatment is not the end. It's the beginning of healing, of slowing down, of listening to your body, and learning to be gentle with yourself. After treatment, focus on taking your hormones consistently, scheduling regular checkups, eating iodine-rich foods, gentle daily movement, getting restful sleep, managing stress. Also, care for your mind. It's normal to worry. Will the cancer return? Can I live normally again? Do I need to hide this? You're not alone. Millions have survived thyroid cancer, and so will you. Support groups offer real stories, advice, and understanding. They help you feel seen and supported. Cancer may change a part of you, but it doesn't take away your power to live with joy. We can't change our age or go back in time, but we can choose how we care for ourselves today. Prevention starts small. Check your neck each month. Go for regular checkups. Eat well, sleep well, reduce stress. If you take one thing from this video, let it be this. Be proactive. Trust your body. Love yourself enough to act early. Understanding your health starts with a simple conversation, like this one. If you made it to the end, thank you. It means you truly care about yourself or someone you love. If this video helped you, please like, share, and subscribe to Golden 60. We'll see you next time on the journey to living slower, stronger, and more fully together.